Hey, this is Dr. Steve, your mayor, giving you your COVID-19 update for the week. The experts predict that we'll reach our peak of COVID-19 activity on April the 20th, and that's for our state of Mississippi. And so what I thought I would do is review the things that we've done in the past to help us understand how the virus is transmitted and how we can keep from getting it, so that we can then operate out of fact and not out of fear. So that's what I want to talk about today. So first, we know it's transmitted by droplet transmission. So that's why if you're sick, you need to stay home. Don't go out and outdoors because you'll spread it by coughing and sneezing. That's what the droplet transmission means. And so if you're home, you can wear a mask if others are around you. And that helps reduce the amount of droplet transmission that others are exposed to. And if your caregiver wants to wear a mask and you're coughing and sneezing, that'll give them a little extra protection as well. Because it's droplet transmission, that means when people cough or sneeze and they touch a surface or they cough or sneeze on it, the virus can exist on that surface. And so that's why we have things in place to help us, and those are we wash our hands when we touch any unknown surface. And that's why when we go in a store, we do not touch our face, because it has to be transferred from that surface to our nose, our eyes, or our mouth. If I just touch the surface and I go back out and I wash my hands, I'm not going to get COVID-19. And that's why we have the 6-foot rule in place, because the virus can only go about 6 feet when it's coughed or sneezed in that droplet transmission form. And so if you're outside the 6 feet, you're not going to get it. And so you can walk down an aisle in a store and be 6 feet away from a person and you're not going to get it. You can ride your bicycle or walk together and you're 6 feet apart and you're not going to get it. I can go in a store and I can touch surfaces, and if I come out and I do not touch my face and I wash my hands, I'm not going to get it. The other category that we haven't really talked about is the people that don't have symptoms. And this is important because in New York, they noticed as much as 25 to 30% of the population that had COVID-19 didn't have any symptoms with it. They weren't coughing or sneezing, they weren't ill appearing, and they didn't feel bad. There's also this other stage that's called a pre-symptomatic stage, and that's a big word that means you're not having symptoms of the virus yet. You're not having the headache, the muscle aches, and the cough, but you're still shedding the virus. And both those groups can still shed the virus. And what happens is that when we leave our social isolation groups and we go and visit with other people, they may be well appearing and they may feel well appearing, but we can expose ourselves to the virus. That's why we say socially isolate and don't visit with others and stay home. There's a lot of fear out there. And you know, it's at a personal level, it's fear about what's going to happen in my job or business and what's going to happen with my children and not being able to go to school and what's going to happen in our community. And I have those same fears myself. There's a verse from the Bible that gives me a lot of comfort with it. And it comes to you from 2 Timothy, the 1st chapter, and the 7th verse. It says, "For God has not given us a spirit of fear or timidity, but of power and love and of a sound mind." So if you're feeling fear, that's not coming from God. He doesn't want us to be afraid. He wants us to rest in His power and trust that He's in control. But that power is manifested through us by love, and that means serving other people and comforting others that are afraid and being the hands and feet of Christ in the community. And then He's given us a sound mind. And what that means is that He's given us wisdom and discernment, so we know how to protect ourselves. We know what we can do to keep from getting the virus. We're going to make it through this, and we're going to make it through together. But I want us to make it through without fear. I want us to not be afraid, because we operate out of facts and we know what we can do to keep from getting the virus. And then at the personal level, I want you not to be afraid. God's in charge, and we can focus on His power and His love working through us and trust in the sound mind that He's given us.